Good morning, distinguished guests, colleagues, and fellow healthcare professionals. It's a privilege to be here today and to have the opportunity to share our work with such an esteemed international audience. I would like to extend my sincere gratitude to the Congress organizers for providing this platform to exchange knowledge and best practices from around the world. My name is Reham Zare Alrwaitey and I am Education Coordinator at King Faisal Specialist Hospital, Madinah, KSA. Today I will be presenting a literature review on the invisible load of clinical instructors, challenges and solution, a topic that has significant implications for nursing workforce development and the quality of clinical learning experiences. Introduction. Clinical instructor or educators are experienced nurses who guide, teach, and evaluate nurses in real clinical settings. They hold a crucial role in nursing education and healthcare, yet their contributions frequently remain invisible to institutional leadership and policy makers. Significance. This review addresses a significant gap in nursing education research and practice by synthesizing evidence on the challenges and support strategies for clinical nurse educators, a group whose professional development has been largely overlooked despite their pivotal role in shaping the nursing workforce. Objectives: to synthesize the current evidence regarding the workload and challenges faced by clinical instructors, and to present evidence-based interventions that institutions may implement to enhance educator well-being and effectiveness. Methodology. PubMed and Google Scholar were the database used to conduct this review. Keywords and search terms such as but not limited to invisible load or workload and clinical instructors or clinical nurse educators and barriers or challenges and evidence-based interventions or solution. Nurse, clinical educator or instructor, academic and health care settings, English language, and peer-reviewed articles from 2021 to 2026 were the inclusion criteria. While the exclusion criteria, the study not related to nursing, other languages, or article published before 2021. 10 studies were selected and 6 of them were categorized into themes based on focused area. Theoretical framework. This review is guided by Benner's novice to expert theory and the job demands resource model. The Benner's novice to expert theory provides essential context for understanding a clinical instructor's developmental trajectory and the complexity of their role. Clinical instructors often transition to teaching with minimal pedagogical preparation, creating a gap between clinical expertise and educational competency that affect instructor confidence, teaching effectiveness, and the learner outcome. The job demands resource model provides a framework for examining how excessive job demands and insufficient organizational resources contribute to the invisible workload experienced by the clinical instructors. Together, these frameworks provide a comprehensive lens for understanding the challenges faced by the clinical instructors and identifying evidence-based organizational solutions. Result: what is the invisible load or workload? A combination of cognitive, emotional, and organizational challenges faced by clinical instructors or educators that often go unrecognized by the institution. In this review, we clustered the challenges into 3 big themes. First, about expanding role demands and invisible workload challenges. The other is about structural and organizational barriers challenges, and the other about the professional development gaps and transition challenges. Before we will move to those themes, there is one question coming to our mind. Why does it go unrecognized? There is a three reason could be the answer to this question. First is about the work occurred behind the scenes, many challenges faced by the clinical instructor or educator, the leadership, they don't know about it. So it will not be quantified or to be recognized. Another thing is difficult to quantify or measure. There is no reliable or valid tool to measure accurately measuring those workload and the hours spent with other than their main role as educators or instructor. The third one, it's often considered as a job, just a part of their job. So it will not be valued as a workload, and it's a challenge for those clinical instructors or educators. Theme 1, expanding a role demands an invisible workload. This theme encompasses the multiple responsibility and hidden tasks associated with the role of the clinical instructor. Key challenges. First is the extensive educational responsibility such as orientation, skills training, simulation, competency assessment, and remediation. Another challenge is the high learner to education ratio. Also, the administrative workload not reflected in their job. Emotional labor, including supporting learners, managing conflicts, and advocating for resources. Last but not least, challenge under this theme is the work-life integration challenges resulting from competing professional and personal responsibilities. Theme 2, structural and organizational barriers. This theme focuses on workplace and system level factors that hinder clinical instructors' effectiveness. These key challenges are inadequate educational resources and infrastructure, shortage of clinical instructor or educators, role ambiguity and unclear job expectation, lack of professional recognition incentives and career pathways, institutional policies that create administrative burden and fail to support educational practices. Theme 3, professional development gaps and transition challenges. This theme addresses the issues related to educator readiness and ongoing professional growth. Key challenges are limited pedagogical preparation and especially among the novice educators, difficult transitioning from clinician to educators, a need for ongoing professional development, teaching across diverse clinical settings and learner populations, and specialty and expertise mismatch between the educator and the assigned clinical areas. This graph shows the major barriers to clinical educator effectiveness and their prevalence in literature. As you see here, the highest we're seeing in the learner-educator ratio, workload and time constraint, and the recognition deficit with 88%, 85%, and 78% respectively, while the less than 75% or equal seen in the resource limitation, role ambiguity, and interpersonal challenges. Impact. The combined impact of invisible workload, institutional barriers, and insufficient support leads to burnout, reduced teaching qualities, decrease in motivation, identity confusion, lower job satisfaction, higher turnover in tension, and occupational well-being crisis. So what are the effective interventions? So these interventions arranged from the most effective to the least effective. So let's start with the first and most effective intervention, which is the mentorship program. Mentorship program is mentioned in the Halton et al. 2024 study. It was a scope review, consists of 52 sources, targeting a novice nurse educator transitioning to academic roles. The findings were the mentorship program were the most recommended intervention in more than 40 study or sources in that review. And the most effective approach were the one consists of allocating mentors, having monthly peer meetings and leadership meetings. So the outcome of that program reduce the role conflict and ambiguity, improve the retention and increase the confidence, and enhance the intention to stay. So the second most effective intervention were workload management and reduce teaching load, seen in Buoma et al. 2024 study. It was a cross-sectional design, consists of 645 participants of nurse educators, targeting nurse educator across the Canadian institution. They found in that study working 40 hours per week or less and teaching 4 courses or less annually predicted higher job satisfaction, while working 41 hours per week or more predicted higher turnover intention. So the outcome, this intervention has impact on the satisfaction and retention of nurse educators, and recommended institutional policies on workload is really critical. Another effective intervention is professional development, pedagogical training, and orientation. This intervention were seen in Wolseley and Jacobson 2024 qualitative study that targeted novice nurse educator at transnational campus. They found in that study the novice educators have lack of formal pedagogical preparation, and they were assigned to teach outside their expertise area, and they were uncertain about the role preparation, and this is cause or create emotional burden among the novice nurse educators. Another effective intervention to reduce the workload among clinical instructor and educators, which is the institutional policy and management support. A study conducted by Algomin et al. 2025, it was qualitative study targeting the clinical instructor in nurse education. They found in that study the institutional policies conflict with teaching needs, and there was a reduce in or limitation in the resources, lack of infrastructure, and interpersonal challenges with the clinical staff. So their recommendation, the need for formal training program to reform the policies and increase the resources. This will decrease the workload among the nurse educator or the clinical instructors. Another effective strategy were the peer support and colleagues network were mentioned in Halton et al. 2024 scope review study. This strategy were supported in more than 10 sources. It was targeting all nurse educators, specifically the novice one. They found that regular peer meetings and debriefs, safe spaces for vulnerability, colleagues collaboration, resource sharing show and reduce the loneliness and enhance the sense of belonging, especially for the new nurse educators. Last but not least, the SHINE intervention. It is occupational well-being program conducted by Renee et al. 2024. It was a mixed method process evaluation targeting practicing nurse educator in educational institution. That program consists of 8 weeks physical activity exercise, recovery activities, self-regulation tasks, weekly resource self-evaluation, and 1 hour per week manager support. This show improve in physical activity, promote recovery, support well-being practices, and increase or show a higher engagement among nurse educators. Discussion and recommendations. For educational leaders and policymakers, conduct a workload audit by systematically assessing the actual time investment across all educator role and function. Implement a clear rule definition by developing explicit written role description or job description that specify their core responsibility, authority, and decision-making scope. Establish educator support infrastructure by mandating structured mentorship program pairing the novice educators with the experienced mentor for a minimum of 12 to 24 months period with protected time for mentor and mentee meetings. Prioritize professional development funding by allocating specific resources for educator professional development and by ensuring their access to pedagogical training, clinical updates, and specialty training in their teaching area, and developing policy that support well-being by institute flexible work arrangements, reducing initial work or teaching loads for new educators to retain them, provide access to well-being programs, and ensure that they have their adequate breaks and recovery time. For healthcare system leadership, facilitate the university hospital collaboration and recognize the educator contribution. Recognition is really important for educators to lift up their spirit and support technology infrastructure. Those resources will decrease their workload and fasten the achievement of or completion of those tasks. For future research, expand the geographical research by conducting study on clinical instructor or educators' workload and well-being in underrepresented country or regions, particularly in low and middle income countries that facing different resource constraint. Another thing, study a real-world implementation of these intervention and see how sustainable are they and what are the barriers the facilitator faced by the researcher. Another thing is conduct a longitudinal study following an educator throughout their career to understand the long-term effect of early career support on their retention, on their well-being, and the effectiveness of these interventions. Conclusion: moving invisible work into visibility. Clinical educators are vital to the future of nursing, yet their contributions are often overlooked in institutional policies, career advancement system, and workload planning. This review highlights the hidden complexity of their role and identify 3 priorities for improvement. First, assess and communicate the educator workload comprehensively. Recognize the educator well-being as an organizational responsibility. Invest in evidence-based support strategy. By valuing and supporting clinical educator or instructors, institutions can enhance the educator or instructor satisfaction and retention while strengthening the quality of nursing education and preparing a competent future nursing workforce. Thank you.